Thank you so much, Chairwoman Eshoo, for holding this important hearing today. It's not possible to overstate how important it is that we address systemic racial disparities in our healthcare system. And COVID-19, as well as the pain and violence afflicted upon our Black neighbors, friends, colleagues, and fellow human beings, has brought to the forefront of our conversation the impact of racism on health and well being in our communities of color. We know, and we've heard a great deal today, that the COVID-19 pandemic has disproportionately impacted communities of color, and we have widespread evidence of institutional discrimination leading to poor health outcomes. As a member of this committee and the Black Maternal Health Caucus, we've explored and legislated on the racial disparities in maternal health, but it goes beyond maternal health. And I'm very hopeful that today's conversation will lead to more work by this committee on addressing racial health inequities and social justice. Here in New Hampshire, white people account for 90% of the population, but they're a shrinking proportion of our COVID-19 cases. Just weeks ago, white people made up 81% of the COVID population in New Hampshire. Now that number's dropped closer to 75%. But meanwhile, the proportion of cases among Black and Latinx granted staters has grown. Among Latinx, who make up 3.9% of our population, they now account for 10% of COVID cases. Among our Black community, that make up only 1.4% of our population, they now represent 6.3% of the total infections from COVID-19. So these numbers do not lie. Manchester, New Hampshire Health Department Director Anna Thomas recently said, "The health of our community is only as strong as the health of our most vulnerable residents, and by any measurement, we must do better." She also recently requested citywide data. And without this data, it's difficult to understand where to target resources that are needed. Dr. Brooks, can you provide some examples of initiatives that could help turn city level data into actionable insight and connect with community organizations to provide resources?
I mean, yes, so there is modeling. There's modeling software that if you provide data and accurate data and up-to-date data, it can tell you where to direct healthcare services, where to direct testing, uh, where to have like food supply giveaways. So that's one way. And the other way would be to have, again, standardized data reporting. If we have standardized data reporting, everyone will be reporting the exact information, and then it will be apples to apples.
Thank you. And I wanted to just address the vaccination inequities that has come up. Can you speak to the root causes of racial disparities? I think you have mentioned this in vaccinations, but as we look ahead, what are some suggestions that you would have for making sure that we have equitable distribution of vaccinations? And I just quickly would mention the bill that I'm leading with Congressman Hakeem Jeffries, H.R. 7104, Coronavirus Vaccine Development Act, requiring the administration to plan ahead for the coronavirus COVID-19 vaccine distribution. What suggestions would you have in the limited time that we have left?
Yes, I note that. I would say, first of all, it helps if states or the federal government mandate that if you do not get vaccinated, you don't get, let's say, WIC or SNAP. That is helpful. Number two is, again, access. So Medicaid expansion is crucially important in terms of children and adults, for that matter, getting vaccinated. And lastly, I would say messaging. I mean, we know how to sell soap or fabric softener, but we really need to message into the communities the importance of vaccination. And as a vaccinator, as a pediatrician, the safety and efficacy of the vaccines that we have.
Great, thank you. I do have one more question on incarcerated workers, but I can submit that for the record. Thank you. Our
Thank
incarcerated
you.
population that's been hit so hard.